So earlier, if you see, the societies were very close knit, and all of a sudden there has been a massive shift, especially after all the social media platforms have sprung up, and the way we communicate, telecommunication industry has had a significant shift. So if you look at that, lifestyle in general has changed drastically, and we've not had enough time to adapt to it in terms of what I would say, how communities function.
Welcome back to Life 101. Today we have Dr. Janika Pandey with us and we'll be discussing on a very important topic, that is mental well-being. We will discuss on all the aspects that is related to the health of an individual regarding the mental aspect. We will also discuss the myth and reality associated to it, and we'll be discussing on few other important topics related to mental well-being. If you are interested to know more, please stay tuned. Thank you so much, Dr. Janika Pandey, for accepting my invite and being a part of today's session.
Thank you so much. It is my pleasure to be here and for providing me with this opportunity to have a conversation with you, and I'm assuming a one-on-one conversation with a lot of other people as well.
Yeah. So today what we are going to discuss is a very important topic. Uh, it's kind of sad that we have to discuss it in a platform like this when it should be discussed more often. It is related to mental well-being. Now, doctor, what does mental well-being mean, or what are the illness associated with it?
Okay, so before I jump into it, I would like to
Mm-hmm.
give a broad overview about what health is. So when we talk about health, health does not mean that you do not have a disease.
Hmm.
Um, Definitions are boring, but I'll just put in one.
Yeah.
So
Mm.
it said that health is a state of complete physical,
Mm.
mental, social, economic, spiritual well being, and not merely the absence of diseases. So, you see, there are so many different components in health.
Mm.
And it is sad that we just focus upon the first aspect, that is a healthy body.
Mm.
Okay, we forget that we need to have a healthy mind too,
Mm.
and that's where mental health, mental diseases, mental illnesses, they jump in. So when we talk about mental diseases or mental illnesses, we can think of those diseases which are not visible,
Mm.
and which are happening at a platform which is not so visual. Okay,
Mm.
so that's again like one of the reason why mental illnesses are missed or ignored. So
Mm.
all the illnesses which pertaining to the mind
Mhm.
and our thoughts.
Mhm.
So I'll give you I can give you a clumsy classification, but it's not of practical importance, so I'll try to break it into something which is more understandable.
Mm.
So there are disorders of mood. Mood disorders include low mood,
Mm.
that is in depression, right?
Mm. Mm.
Then there can be states when the mood is always elevated, that
Mm.
happens in panic disorders. Okay.
Mm.
uh, and mania, we say.
Mm.
Apart from that, there are some disorders in which the mood fluctuates between high and low, so that's when
Mm.
bipolar diseases are put. Okay, so this was mood disorders. Then there are disorders of personality. So personality disorders, they usually happen because while a child was growing, they did not get the most ambient developmental environment.
Mm.
Okay. Apart from that, there are other disorders like panic disorders, anxiety disorders. Then
Mm.
again, we can say ADHD. Okay,
Mm.
these
Mm.
fall in the spectrum of all the panic disorders.
Mm.
Then we have disorders related to eating,
Mm.
which are bulimia and anorexia. So
Mm.
I'll just keep it short and
Yeah.
confined to these because these are the ones which we commonly encounter.
Mm. And there are ones which
And
we develop
okay, yeah.
yeah, which we develop through birth, or which is more, is there classification like that also? Like some comes
uh
from, yeah, genetics and
well,
all
I
that.
cannot say that. Okay, yeah. So I would say that I mean, there are two factors, okay, to this.
Mm,
I'll say uh, mental illnesses have certain risk factors associated with them.
mm,
Okay, so now these risk factors are either present in our immediate environment,
mm,
or it can also be dictated by our genetic lineage. So what
mm,
happens is that certain genes, they make us more prone towards depression. Now that
mm,
does not mean that if somebody does not have a history of depression in the family, the person cannot have depression
mm,
in their lifetime. They
mhm,
can, if they have the environment which is pushing them towards depression, they can
mm,
develop depression. But
mhm,
I would say that there are certain diseases or certain mental illnesses which do have a genetic linkage. And
mhm,
if you have the genes, if you have a family history, it's more likely that you can also develop the similar mental illnesses
mhm,
uh, in case you encounter certain triggers in life. Now, those
yeah.
triggers usually are stress,
Mm,
difficult situations, all the transition phases in
mm,
life.
mm, mm. Thank you so much, doctor. Like, I think this is a very good definition. People can, feel like many of us will be able to associate us with one or the other diseases with the, stressing environment that we have around us. Now, do you think that mental illness is real, and it should be a topic that is more spoken about?
Yes, I mean, like, see, I'll give you an example.
Hmm.
Uh, we we know that air is essential for our survival,
Yeah.
right?
Hmm.
We breathe in the air, but we're always taught, like, can you see air?
Hmm.
And then they'll be like, but you can feel it, and you're breathing in and out. So
Hmm.
the same thing with mental illnesses. Just because they're not seen does not mean they do not exist,
Hmm.
does not mean they're not affecting our health.
Hmm.
Okay, but they are there, and they're as essential to be discussed and to be addressed as all the other illnesses are.
Speaking about, people not being able to see, like something that you said earlier, people cannot see it like a physical disease. Like if somebody has a fracture hand, you can see it, right? Maybe everything is so theoretical, that's why people miss out on that aspect. Because even to diagnose mental illness, everything is so theoretical. There is no specific test that you do and you find out that you are going through this. This could be one factor. And can medical science develop something that is like more practical rather than being it more theoretical? Because when it's theoretical, people take more time to accept that it is happening.
Um, okay, there are two factors which actually are responsible for this. First
Mm,
one being, if you look at how human beings are, we are
mm,
visual creatures, right?
mm,
Even
mm,
in class, like we get we can be more focused if there's an animation going on.
mm,
Like, you just have to look at a kid. A kid
mm,
is more happy to watch a movie rather than to just listen to a plain boring narrative, right?
mm,
So that's because that's how human beings are. We are visual creatures.
mm,
Now, in this case, it just turns against us, in the sense that since we cannot see that there is an illness. Okay,
mm,
so that's why, like, the human perception is that, if it's not seen, it's not there.
mm,
And sadly, like, there are some people who might even abuse
mm,
this particular reason, right? And they are just, like, creating a whole kind of another, like, set of problems while they're doing so. Anyway,
mm,
but then that's not the case with majority. So we are visual creatures, and we tend to grasp things better when we see them. Okay, so that's one of the reason that all the mental illnesses are not so much acknowledged.
mm,
Now, moving on to another thing that you talked about, that things are theoretical. Yeah, I do admit they are theoretical, but it's not that we do not have certain parameters or specific tests. uh,
mm,
the psychiatric team, they are very well versed at
mm,
diagnosing the things. And they have a set of questionnaires, they have specific tests also at
mm,
time. And it's not that they do not exist. However, I would say the problem is that we do not know how to obtain
mm,
the services of, like, a psychiatrist or a psychologist, or get to a place where you can have a good therapy.
Hmm.
And apart from that, I think accessibility is one of the major factor. That's what I feel.
Hmm.
Second is the taboo associated in seeking help.
Yeah.
And thirdly, when you talk about if something more can be done,
Hmm.
yes, I mean, like, I would say neuroscience, neuropsychiatry is one of those fields which is going to be buzzing with so much activity
Hmm.
right now also and in the future, and there's so much to explore, I would say.
Mm-hmm. And doctor, something related to you speaking about accessibility. Now, how can we make it more accessible, or how can it be easier for people to communicate?
So let me walk you through the social framework.
Hmm.
Now, mental health is not just the responsibility of a certain few people,
Hmm.
right? It is the responsibility of each and every human being, because human beings live in communities.
Hmm.
Communities are formed by us. We form part of the society. So each and every one of us is responsible for that. So earlier, if you see, the societies were very close knit, and
Hmm.
all of a sudden there has been a massive shift, especially after all the social media platforms have sprung up, and the way we communicate, telecommunication industry has had a significant shift. So if you look at that, lifestyle in general has changed drastically, and we've not had enough time to adapt to it in terms of what I would say, how communities function. So the
Hmm.
earlier, all the in communities, there were bonds, okay, and say like you had a good friendship with a certain group of people, and that was your mental support system.
Hmm.
You could
Hmm.
rely on them. So what I'm trying to say is, I do admit that we need to have more places where we can go, and more organized dispersal of services. But
Hmm.
at the same time, we need to evolve as a society, as a community,
Hmm.
and make sure that our support systems exist in the close vicinity. It should
Hmm.
be in the form of our immediate, we can say friends, relatives, neighbors, family. They also have to act as a support
Hmm.
system.
Hmm.
And in order to come to that point, I think we you, I would say, you're doing a great job by bringing this up on social media through podcasts, webinars. This is going to help a lot.
Yeah,
That's what I would
yeah,
say.
that's the aim. Because our podcast is all about teaching things that should be taught in school, but sadly it is not. So it's just my way of giving back and saying that it is real and it should be something that should be more spoken about. Now, something related to what you said earlier, that accessibility part. Is it
Yeah.
also because it is expensive? Now, we have to admit that counseling is expensive, and not many people might be able to afford. Do you think that our government has kind of failed to understand that happy minds is the key factor to a happy society?
I think yeah, I mean, like, to an extent, I would say that therapy can be expensive, but
Hmm.
I think that's not the case at all the time. It
Hmm.
depends on a multitude of factors, because
Hmm.
uh, it can be expensive to some, it can be not so expensive to
Hmm.
others. It's quite relative and subjective, I would
Hmm.
say.
Hmm.
But even in I would say, even in the societies where healthcare is free, like there
Hmm.
are
Hmm.
countries, right? So even out there, people might not go and seek help. Now,
Hmm.
why is it so? That's because of the reason that there's a certain taboo
Hmm.
associated with seeking help.
Yeah.
Okay. And apart from that, it's if it's not about the society, it also becomes about the self. In
Hmm.
certain cases, society does not have a problem if you are acknowledging that you need help, because
Hmm.
societies are evolved. In
Hmm.
certain countries, that's the case, right?
Hmm.
But people have a problem seeking help, because
Hmm.
if it is something related to the mind, we perceive it as a part of us,
Hmm.
that's me, that's my personality.
Hmm.
And whenever we think that there's something wrong with myself, that's like a threat to the image that we have of ours
Hmm.
over a period of time.
Hmm.
And that's why it becomes very difficult for the person to seek help. They
Hmm.
feel that no, I think it's not wrong. So that's where the concept of insight and denial comes in. Like,
Hmm.
insight means when somebody is aware that they need help and they go and seek help.
Hmm.
But there might be a person who is having a lot of problems in day to day life, but they feel like it's normal and like
Hmm.
I'm all right.
Hmm.
So they would not go and seek help.
Yeah.
So all these factors, they come in play.
Yeah. So what I can take out from this conversation is there are two main factors. One is us not willing to speak about it, and the second one is that we are scared that how other people will receive it, or it's also important that the person who is receiving it should create a safe environment. So the here communication is the key. Maybe that person will, if I am going through a certain illness, and if I do not speak about it, maybe that person will who is willing to receive it is not able to receive it, because we think that I don't want to give stress to my mom, or I don't want my mom to be more stressed about me, or I don't want people to know that I'm going through this. So I think communication is the key here, right?
Yes. The one thing that we all lack, I would say, as a society, is that somewhere, somehow, we started believing that, if you just ignore your emotions,
Hmm.
then that's all right. So you see, if a child cries, uh, I mean, I'm not saying specifically, but usually what happens is the mother would say, like, don't cry.
Hmm.
They do not let the child cry to their heart's extent, and then comfort them by saying that, it's okay if you feel that way, I'm here.
Hmm.
So that one thing is the major factor. Like, by doing so, we are encouraging the child to shut down upon their emotions.
Hmm.
And what happens is, in childhood, if you have a habit, it's going to be propagated to a later stage in life. So what
Hmm.
happens, you've told the child that you should not cry.
Yeah.
So the child might think crying is a bad thing, it's a
Weakness.
bad
Hmm.
emotion.
Hmm.
Then they would feel that you should not express yourself.
Hmm.
And this habit is going to be seen in all the other aspects. So
Hmm.
if, for example, say at later stage in life, the child is undergoing, like, maybe they have a panic disorder, or they have a certain phobia, they would be like, I should just not talk about it, because that's the
Hmm.
habit that we develop. So
Yeah.
it's very important to acknowledge the emotions, because once we acknowledge, be it fear, be it, like, be it panic, anxiety, nervousness, everything,
Hmm.
we need to acknowledge. And
Hmm.
we need to acknowledge it, and stop judging ourselves and
Yeah.
stop judging others.
Others.
Like,
Hmm.
no emotion is good or bad.
Yeah.
Crying is not a bad thing, crying
Yeah.
is not a good thing, it is just needed sometimes,
Yeah.
right?
Yeah.
So that's what.
Yeah. And sometimes we associate emotions to being weak, or associate emotion to weakness, which is also wrong, because if we are feeling certain emotions in our mind or in our heart, then it is required, right? That's why it is there. You know.
That's true.
Mm-hmm.
I mean, like, what I would say is that, when we talk about weak and strong, that's again like a perception.
Hmm.
uh, we say that expressing yourself might be a sign of weakness, but somewhere,
Hmm.
somehow, we formed a judgment inside our mind that weak is not good, and
Hmm.
that's why we do not want to get associated with weakness.
Hmm.
So that's one of the factors, right? Everybody wants to be strong, okay,
Hmm.
and they have a problem being weak.
Hmm.
So we have a judgment here. We feel like strong is good, weak is bad,
Hmm.
when we all need to function at a plane where, we should be like neutral about it. What's the
Hmm.
harm in being weak and strong, and how do we even define it?
Yeah.
So we have to explain it to ourselves. I mean,
Hmm.
like, later on in life, what I feel that, a lot of problems occur because we uh, we think that we are being judged by
Hmm.
others, but we are not willing to give upon our own judgments, like,
Hmm.
like this one. Like, we have a certain perception of ourselves, like, want to look like this, I want to
Hmm.
speak like this, I want to become like this. But when we are thinking in that those terms, somewhere we are forming a judgment, and then, we are regarding one thing better than the other, and that's why we are not happy with ourselves.
Hmm. Hmm. Hmm.
So that judgment has to go. And again, like, we need to talk to our parents, right,
Hmm.
about our emotions.
Hmm.
We expect others to have empathy for us. That's what happens. But how many of us do actually talk to our parents and try to analyze what their traumas are? Okay,
Hmm.
so
Hmm.
that's also one of the thing. Like, in order, if you want yourself to be treated in a certain way, you should make sure that you treat others in the same way. So
Yeah.
that judgment has to go from society and from us also. We
Hmm.
need to
Hmm.
get rid of that.
So true. And also, I feel like the accepting factor, like you rightly said, earlier we were a community which was closely knitted. That's why maybe our elders will not be able to understand this. But since our parents also and our generation are shifting towards that virtual communication stage, so that's why we are, realizing that, this is a part of it. Maybe because we are not surrounded by people that much, that's why we are seeing it as a growing factor. But it has been there always. So it's very important to be acceptive of the fact, if I am going through stress, I should be able to speak or communicate, and the person is communicating it should be able to receive it the right way. Maybe don't judge, maybe just listen. Sometimes you
Yeah.
just need somebody to listen to. So how important do you think listening is without judgment?
Well, listening is very, very important, because and there's a certain set of things that we should follow while listening to others, or maybe, like, that's going to be helpful. So I'll start from this point, like the
Hmm.
point of, you said that, like, there was a lot of acceptance in communities. And I feel like, yeah, that's one of the case. Like, human beings have evolved to associate themselves with a community. Like, that
Hmm.
was nature's way of encouraging survival.
Hmm.
Because if you lived alone, you would not have survived. Now, with the passage of time, things are stable, and then it's not a necessity, but then, as a human being, okay, we have to we have to be with others. It's important for our mental health, and that's
Hmm.
where we tend to doubt ourselves and want to be in a certain way and want to be accepted by society. Okay. Earlier, I think it was easier. Like, I would like to bring in a point from your previous question. You
Hmm.
said that mental taking care of mental health is expensive. I would say there are two aspects to it. Like, there's a point where which is called preventive medicine. Like, you do
Hmm.
not let the thing happen. Okay.
Hmm.
So I would say preventive medicine, the aspect of preventing mental illnesses, might not be that expensive, but our
Hmm.
lifestyles are not letting us do that. Like, that's
Hmm.
what the thing is. So now, moving on to talking about our feelings. Okay. So we need to communicate. We are human beings. We need each other. We need to be openly communicate. Now,
Hmm.
the first step when we communicate, what happens is that you break the chain of denial.
Hmm.
There's an acceptance, and when there's an acceptance, only then you would be able to work towards improvising something,
Hmm.
right? So for the one who's suffering, you are, like, moving one step ahead in terms of, like, getting over that particular problem.
Hmm.
And for the one who's listening, it is very important that you should be devoid of judgment, because
Hmm.
if you're judging someone, how can they, like, expect them to be so open about it? Okay.
Hmm.
And then we have to change the way we acknowledge emotions.
Yeah.
So say, for example, somebody says that, like, I'm afraid of the night, or maybe
Hmm.
I'm afraid of doing a particular thing. So
Hmm.
our reaction should not be like, oh my god, why are you afraid? I know you surely can get over it. So
Hmm.
you do not have to question them by saying, why are you feeling so? Okay. The first step is you need to acknowledge. You need to be
Hmm.
like, I understand it is difficult, and
Hmm.
what you might be undergoing is not easy. So
Yeah.
this particular sentence has a lot of relevance. We need to
Hmm.
change our responses when we are listening to someone. So this is a skill. I feel like, if we talk about it, more and more people would be able to understand. Like, sometimes it happens when we see a loved one
Hmm.
who's undergoing
Hmm.
something. We get so frustrated because
Yeah.
they are being hurt, and that's making us get hurt.
Hmm.
Okay. So the first step is, you should not have this a rush that you need to get the other person out of the
Yeah.
situation.
Yeah.
Just acknowledge. Just be like, I know it is difficult for you, and I know it's not easy, and what you're undergoing, is actually very difficult, like
Hmm.
something like that.
Hmm. Hmm. Hmm.
That's one thing I think we should
Yeah.
develop.
Yeah. And speaking about that, like how does one, like, because of the hyper reactive society that we have tensions, right? We have tensions related to studies, we have might have tension related to building our career, or even simple as a relationship stress. Now everyone is going through a kind of stress, but how do we stop it from being chronic? Or what are the things that we should do when we are going through those kind of steps as a preventive measure?
Okay. You're completely absolutely right. Like
Mm-hmm.
there were stresses in the past, but then I think in today's day and age, it has become all the more difficult to cope up with things. Now,
Mm-hmm.
you see, what happens is that when we are growing up, like in childhood, uh, it's a very delicate balance and a very complex balance, the way our brain develops. So what happens is that we slowly get used to the external stimuli. Now that stimulus can be in the form of a visual or an audio. Like, we form reactions, like a child sees a thing and then they identify. So it's a very complex thing. Now in today's time, ironically, what is happening is we are exposed to a lot of stimuli, and
Mm-hmm.
it's kind of overwhelming for us to process so much information all at once. And that's one of the factors which is making it very difficult to cope up, all the more difficult, right? And societal expectations are rising, they're at all time high. Apart from that, what happens is that mental illness issues are not talked about.
Mm-hmm.
I'm happy that like in the recent times we are able to talk more about it, but then at the time when the child is developing, there's nothing significant we are actually doing. So in order to develop coping mechanisms, I would say that it should be done in early childhood, when the child is growing up. So they need to have coping skills in place. That should happen at the level of, I would say, at the level of schools,
Mm-hmm.
or at home. The parents need to make sure that they have coping mechanisms, because what happens is that if we do not know how to cope up with a certain situation, chances are that in adolescence, or when, like, we come to that phase when we are seeking a job, or we are out of college, out of university, we are just going to be clueless, and life is going to go haywire,
Mm-hmm.
because we do not know how to cope up with things.
Mm-hmm.
Okay. And what happens is that if we do not have the coping mechanisms in place, what would happen? There's a problem, you do not know how to cope up with it. Now that problem is going to become a part of you,
Mm-hmm.
because you are not doing anything to break free from the cycle. Now as a result, what happens is sometimes the brain, as you see, we form neural networks. That is, when we get exposed to a certain a new stimulus, we have a certain response. You see, like at times it would be like you go to a similar place, and you have a certain feeling that you had in the past, and you have those emotions resurging. Okay, that's because brain works by neuroplasticity and neuroconditioning. So we get conditioned now, because we are not coping up with a thing for a long duration of time. We start to develop a particular pattern of behaviors, and that becomes a part of our personality. Then, say for example, like, you were afraid of the dark, and then, like, you have a habit of bolting the doors, and you go and check it again because you're afraid. Now what happens is that if at that point of time you do not reflect upon your behavior, and you say, okay, fine, I need to do something. Okay, maybe people can do it on their own, some people cannot, and they
Mm-hmm.
might need help with it, which they're not aware of. And some people might not even recognize it as a problem, because they do not have the insight, right? There are three categories, I would say. So what would happen, like, over a period of time, even if you're not scared, that would become a habit, that you go check the bolt each time. Okay,
Mm-hmm.
because you're so anxious about it. And then you're paving way to an OCD. Like,
Mm-hmm.
an OCD is born this way. So what I'm trying to say is that if the coping mechanisms are in place, I'm not saying that we can prevent all the mental illnesses,
Mm-hmm.
but to an extent, maybe we can bring the numbers down. That's what
Mm.
I would say.
Yeah. So to prevent it from chronic, there can be ways that we can do at home, like maybe communicate, write a diary, because that's when you release your stress, right, in one way or other. Because we do not release our, it's like an airtight conditioner, right? I mean container, right? The amount of pressure that's built up, if you do not let it release, it might break, or it might, damage things that are in. Uh, at one point or the other. So I think there should be ways that we should be able to release stress, like I said, communication, writing a diary, or even meditation, or even traveling. Do you think those things helps?
Yes, absolutely. You're so right about it. So, if you see, like, writing a diary,
Mm,
why does it help? Because you're sitting, you're reflecting upon your own emotions. And
mm,
as I said, acknowledging your emotion is the
mm,
first step. Okay. So, what we need is we need some time to sit back, relax, and unwind. And here I would like to talk about the WHO approach of grounding yourself. Like, have you heard
mm.
about it?
No, no, please
Okay, so what they say
speak.
is that whenever you're having, like, a phase of, say, a panic attack, or maybe a phase in which you feel everything is out of control,
Mm,
what you're supposed to do is you're supposed to uh, cut all the external stimulus. Like,
mm,
you need to disconnect from your surroundings. You just need to sit back and then be with yourself. Now, you see the importance of this. When you're sitting back with yourself, you're getting time to reflect. And there would be a point where you would see, okay, this is the problem. Then maybe that would not happen all at once. But after, sustained efforts, you can come to a point where at least you recognize there's the problem. Now,
mm,
that's the first step. After that, maybe, like, you can work upon it, try to see that sometimes it's more or less like, phobias, I would say, like, they're unreasonable at times,
mm,
but not for the person who's undergoing them. But once they sit back and think about them, maybe they can see that, there's no reason to it, or they can, like, encourage themselves by, like, saying that you can brave this, things like this. So again,
mm,
writing would be very of so much use, right? And again, travel is going to give you time for introspection, and it's
mm,
also going to, like, it's more like it's a soulful and a sweet way of connecting with our external environment. It's
mm,
not like that rapid chaotic way that usually we experience our surroundings because of all the stress, all the expectations, and all the deadlines and stuff. So
mm,
travel, again, it is very effective. Meditation also slows down the system. We kind of have time to reflect and work
mm,
upon things. So all these ways are very useful. So the WHO says you need to ground yourself,
mm,
disconnect from the surroundings, and then what happens is, then once your body is not in the state of panic, you can slowly and gradually connect to your surroundings again. So
mm.
this might be helpful.
Yeah, and also the fact that cutting down yourself from your surroundings is helping you means that it is not your fault that you're going through all this. It is the surroundings that is creating certain stimulus that is helping you react that way. So we should stop feeling guilty about going through stages like this, right, doctor? Or what do you say on
That's
this?
Yes, that's so important. We need to stop feeling guilty about things that we are facing. Okay. And that would happen when, like, we view things in on a neutral plane.
Hmm.
So we have to stop feeling guilty that I am this way, I'm fearful, or maybe, like, I'm depressed, I'm anxious, or I look this way. Okay, so we have to stop feeling guilty about things. And you see, we are not responsible. Sometimes it happens that, like, since you are undergoing certain things in life, you might feel that you're creating a problem to your parents, to your family, to your partner. But we need to have time to ourselves, relax, and be like, it's okay, like, that's
Hmm.
the way I am. And if it is impairing my day to day functioning, then maybe I can work upon it. And again, like, I like to bring a point out here. Like, when we talk about mental illnesses, sometimes, like, in our mind, we devise this response that we need to just get over it. Okay,
Hmm.
what if we are never able to get over it, but come to a level which is not impairing our day-to-day life. And
Yeah.
that's what happens. Like, there have been such ingenuous people in the past who did face something or the other, but then they were so good at it, and they kind of accepted it as a part of their personalities and did not let it impair their day-to-day functioning.
Hmm.
So that kind of acceptance also might be needed in certain cases. That's
Yeah.
what I would
Yeah. And
say. Yeah.
if you have reached to a level wherein you think that all this is not helping, you cannot help yourself, if people around you are not able to help you, that's when you should seek counseling. And counseling, why it is important is because, like I said, sometimes we feel guilty that we are going through that, and sometimes the person that we are communicating to might feel guilty that that person is going through that, and that might create a stress for the other person. So I feel like that's when we need the right kind of counseling, so that we break the chain of this stress building.
Yeah, that's very important. Now, another thing that you mentioned, that we are always scared that people might have the stress, and that's what happens. Like, if the immediate family is or the spouse, or like, the partner, the friends, so they say that when they're taking care of somebody who's undergoing a mental illness, they themselves might become so involved, and they're so worried that they also have the tendencies of developing depression, anxiety. And that's one of the very common things that happens, that and like, it is advisable that the carer themselves, they take care of their mental health.
Hmm.
And when it comes to family, we have our emotions
Yeah.
involved, and
Yeah.
it's not easy all the time. That's why, doctors, they do not try to diagnose their own family.
Hmm.
And the role of a counselor is so important, because a counselor is a third party. They're
Hmm.
unbiased. It's not going to affect them. They have empathy. Empathy is different, right?
Hmm.
It does not mean that it is affecting them, right?
Hmm.
So that's why it is very important to speak to a counselor, because they'll be unbiased, and they can at times be more helpful than all the immediate uh, people are. That's what I would say.
Yeah, yeah, and also one thing that I would like to speak about when we speak, it is important to have counselors around, counselors that are reachable. So I feel like government has this health checkup day, right, wherein people will come, they will do free health checkup. I think it's important that we have health checkup on mental well-being as well, so that people can come and speak about it, and then they know that they are counselors, or have a list ready wherein we know that these are the people that we can connect to and get help from. Now it's all there virtually and all that, but it's also the accessibility part that is missing, and also the costing part. So if if certain bodies can come up with the way that they have these free health camps, if we can come up with health camps that are associated with only mental well-being, I mean I think that this is really needed, and this is really important.
You're absolutely right about it.
Mm.
See, I would like to tell you that ideally, like, the guidelines say, the existing guidelines which are set, and I think long back,
Mm.
like, according to them, a clinical psychologist is needed, okay, in
Mm.
institutions which are big. That means that schools need to have counselors, okay,
Mm.
colleges need to have counselors. But in practice, like, how many counselors do we
Yeah.
see in day-to-day life?
Mm.
So it is very important that these provisions that have been made, they are strictly followed as well. Now, one
Mm.
of the reason why counselors were not so easily available might be that, even taking up psychiatry was a taboo in the past.
Mm. Yeah. Yeah.
Okay? It was a taboo. Like, people used to be like, okay, you are the doctor of the mad people. Okay,
Mm.
that was one of the common things, right? The family would not be so supportive. So I feel like, even for the like, counselors, clinical psychologists, or for the psychiatrists, I think it is becoming easier with the passage of time, because we have started acknowledging mental issues as real issues, and not just like, how people, I think, how early man might have been thinking that there's something wrong, so there's a supernatural element involved,
Mm.
right?
Yeah.
So yeah, so I think our perceptions are changing, and I'm positive that with the passage of time, and with access to all the internet platforms, I think
Mm.
getting access to counselors would not be that difficult.
Mm-hmm. So, doctor, to what you said right now, I want to read out the data here. In the fall of 2021, the Academy of Pediatrics, along with the American Academy of Child and Adolescents, Psychiatry and the Children's Hospital Association declared a national emergency in child and adolescents mental health. That means it is a national emergency. If a certain body has declared it as a national emergency, means that it has to be addressed. And I also feel like you rightly said, schools, colleges, and other institutions should come up with having a counselor. Now also I see that few of them have counselor, but how do we know that that person, certain person who is there as a counselor, is the right person? So it's very important that we have certain bodies that checks on this, and also checks that the person who is there as a counselor should be someone who is more, how do I put this in words, but somebody who is a real doctor and who knows about the ins and outs of how this communication is going to go about. And also one more important thing is that it should be you know it should be a safe space. That means whatever the conversation is going on between the two shouldn't be going out at any point of time. So I feel like it is important that our schools and colleges has those counselors, and there should be a body that checks if that person is qualified for that position or not.
Yeah, I mean, like, that's important because if you cannot open up
Hmm.
to a certain person, right? And you do not have this belief that the person is going to keep it confidential. Like, that's what the principle of confidentiality is.
Hmm.
So in that sense, like, I think what can be done is that there should be an awareness. Like, you see, what happens is that when a patient goes to a doctor, it is understood that there's patient confidentiality. And when we study in med school, we are taught all these ethics. This is a part of medical ethics, that patient confidentiality is of utmost importance. So whatever information is given to the doctor, it stays safe with them
Hmm.
and with the team, maybe, if they have to discuss, unless the person specifically wants the doctor to keep it just to themselves, which they might specify.
Hmm.
So it's like, people need to be assured, and like they have to feel free to express in front of a doctor or a counselor, because they are trained in that way. They do
Hmm.
not have to be scared. Now,
Hmm.
moving on to the point that checking that such authorities are in place and they are functioning, I think we all need to be vigilant as a society. First and foremost, society has to pay importance to mental health. If they
Yeah.
pay importance, parents would be more vigilant. Now,
Hmm.
then parents would know that, like, my child's mental health is of importance. I need to ensure that they go to a school or a college where there's a counselor. So they'll also identify, like, there are some behavioral changes. They might also go and, like, go to the school and say that, counselor, my child needs help. Or maybe, like, it can be done in
Hmm.
that way. The child can be made of aware of the fact that there's a counselor in the school or in the college. So like, ensuring that a counselor is in place is one step. Then the society's, I would say, views and ideas, or how much of importance they give to the counselor being in place. That is how much importance they give to mental health. That's another factor. And third would be that schools and colleges should make the children aware that, in case they are undergoing something, we have a counselor in place, and then you can go and talk to them. So I
Yeah.
think these three steps would be helpful.
Yeah, and one more important thing that I would like to add up is checking if that counselor is qualified to be sitting there as a counselor. I mean, that is important, right? Just because of the sake that there is a counselor, it's not okay. It will just add up to the problems that we are having. But to check that the counselor is
Is
qualified
qualified.
to be
Uh,
a. Mhm.
okay, for that, I think there are two aspects to this. Like, one being that usually there are criterias for
Hmm.
counselors, and because the criterias are not met, like the
Hmm.
qualifications are not met, that's why most of the positions are left vacant,
Hmm.
because we do not have ample amount of people who fit into the criterias. Secondly, like, counselors who are already in place, they can be well versed and up to the mark by undergoing trainings from time to time. And that's what I have seen in the recent days. It has become quite easy because we have a lot of webinars, we have a lot of talks, so
Hmm.
that keeps them updated, and they know their job well.
Hmm.
Yeah.
And also, just like you said, virtual thing is real now. So what we can do is, if we are unable to find a certain counselor who can come and sit in the college, we can use one-to-one virtual sessions as a
Yeah,
mean to address that. I mean, that will help, right?
that would help, in fact.
Mm.
But then again, like, I would like to say that, see, in the real world, usually qualifications matter, but
Mm.
in the virtual world you need to be all the more careful, because you do
Yeah.
not know whom you're talking to.
Yeah.
Okay, in
So.
that case, like,
Mm.
you need to go to the counselors who are well known, or maybe established. Like, you would know that through
Hmm.
reviews, and go to reliable websites or
Hmm.
resources. That's what I would recommend. So be careful on the virtual world.
Yeah.
Yeah.
Yeah. Also, what I meant was, like, for example, there are 15 colleges in Nagaland, just example per se. And if the 15 colleges are unable to, bring in a physical counselor, what they can do is they can do the research, find a good counselor, and we can do a, virtual setup. You can, show if somebody needs counseling, they can come and, they can set up a counseling session for them. So that can work that way, just to have that accessibility, right? But then it
Yeah,
is important.
that's
Yeah.
actually a very yeah,
Yeah. Yeah.
that's a very nice idea that you
Yeah.
have, like,
Yeah.
because that's in that way we are making optimal utilization of the technology that we have, of human resource, right, and then
Hmm.
of time, space, everything. Like, that's the best way that one can function. That's
Yeah.
a very nice idea.
Hmm. And also, just a message that I would like to give to our students. If you have a student council in your school, if you have a student council in your colleges, I mean, it's okay to speak up and to the authority and say that, we need a counselor that is present in our school and institute. And if I don't think anybody will deny it, but it's also important that we know our rights and we go and ask for it. So I'll just, if any listeners who are here from school or colleges, I would request you to go and ask for a counselor. And it's okay to, ask them if the person is qualified or not. And if, like I said, if they say that it is difficult to bring in counselor, the idea that I gave about virtual session is already there. So, this will help a lot in ways that we can't even imagine. Also,
Yes, I think.
yeah.
Yeah.
Also,
Yeah.
speaking about acceptability in our society, I feel like it is very important for us to create a safe space, a space where we can go and speak to. Like, for example, I have ADHD. Now, people who do not know ADHD, it's just lack of attention, and it affects my day-to-day life in many ways. Like, I cannot give attention to a certain thing, and it also affects my relationship. For a long period of time, I was unable to understand why this is happening. Why I'm not able to give attention to things. No, even if I want to, I because it's a personality trait of mine, I cannot. Then I, was in a guilt trip that maybe because of me it's not working out, I'm hurting people and all that. But then I realized that it is important for us to have a safe space. Now, when I say a safe space, what does it mean, doctor?
um uh, I think that would be very subjective. I
Hmm.
think a safe space for someone, maybe, like, staying in a closed room.
Hmm.
For somebody else, it might be to be with a lot of people, because they
Hmm.
feel scared when they're alone.
Hmm.
Okay, that's in terms of the environment. Now,
Hmm.
in terms of a mental plane, like, a safe space maybe when that, like, you're satisfied that it's okay to be this way.
Hmm.
That's your own safe space.
Hmm.
I mean, a plane of acceptance. Then
Yeah.
again, for somebody, it might be like, their family is accepting them the way they are.
Hmm.
Okay,
Hmm.
and that makes them feel that they are in a safe space. So I would say that it is subjective, but
Hmm.
in general the idea would be of acceptance from the
Yeah.
self and from the surroundings.
Yeah.
And I really admire the fact that, like, you are aware of, like, your ADHD, and you're
Hmm.
doing things to, like, acknowledge and then get over it. That's
Hmm.
quite brave. I mean, like, as I said, like, when we know about things, that's one step in the way, and then, like, the entire path, then we can make it,
Hmm.
like, something like
Hmm.
that.
The reason why I ask about safe space is because, like, the ongoing process of guilt makes me stressful, and sometimes I get panic attacks because of that. And panic attacks are something that you cannot control of, right? Like, right now I might be having a very happy day, I might be going on schedule, and suddenly I feel like I have to sit. Like, my palms are sweating, my legs doesn't have the strength to hold me. I just want to sit. I feel like I am losing my breath, I will try to, panically try to breathe. And sometimes people around us doesn't know what to do, so
Okay.
even if they want to help, they don't know what to do. So what, I mean, it's subjective, like you said. Some people might just want to stay alone, and some people might want to, have people around who can, say everything is going fine, or giving them affirmations. So, just for people who see people going through those kind of stages, how do they react?
um, uh, See, the first foremost thing would be having empathy. Okay,
Hmm.
because if you're not empathetic enough, you can never make the other person comfortable. And the second step would be like, somebody can help the other person by just listening, or by for a certain amount of time, maybe going away from them. Like, again, I said that's subjective, but I'll
Hmm.
just give a general idea. This can be a safe space can be created in two ways. Okay, either by the self or with the help of a counselor.
Hmm.
So there's a concept of cognitive behavioral therapy is a type of therapy. Now what happens is, I'll break it down. Like, cognition is the way you recognize or identify a certain thing. So for
Hmm.
example, if somebody is addicted to alcohol, they might say that, like, when the lights are dim and the music is playing, I just have this reflex that my hand goes towards the bottle of alcohol.
Hmm.
And that's their trigger. Okay, so in cognitive behavioral therapy, what we do is we ask the person to identify what is their trigger. Okay, so you need to sit down and identify your trigger, maybe write it down. And slowly what you do is, your behavior, that is like the person who wants to give up alcohol, now they would be like, when all these surroundings are there, like the lights are dim, music playing, I feel like I have this urge to drink. So they start drinking. Now what behavioral therapy would do, we need to replace the stimuli with a different response. Okay,
Hmm.
and now this does not happen overnight, it takes a lot of time and effort. But slowly what you can do is, instead, like when the lights are dim, the music is playing, instead of going towards the bottle of alcohol, you can just take a book and start reading it. So
Hmm.
what you're doing is you're rewiring your brain. Okay, the stimulus is the same, but you're changing your response. And
Hmm.
this can be done, like, if you have family around, they can help you with that, your friends can help you with that, a counselor can definitely help you with that. But these are the certain ways in which you can change. So changing the response, so I would suggest that you should write down all the triggers that lead to the particular response, and then slowly replace it by another response. And that's not going to be easy, it's difficult.
Yeah.
But with sustained efforts, I think you can come at a point where you identify how I can calm myself down.
Hmm. 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 And I feel like it is high time that our families, like when we have a headache or when we fall down, they come and say, are you okay, do we need to take you to a doctor? Now if you see your child is, secluding themselves from the world, if they are talking less to you, if you see that that person is always sad, and you see a drift change in their personality, go and ask, are you okay, do you need help? It might be few words, but it can change somebody's perception of accepting themselves and communicating to you,
Yeah,
right?
yeah, that
Mm-hmm.
acknowledging the emotion that, like, you do not seem fine, is are you okay, can I do something to make it feel better?
Mm-hmm.
So yeah, these are few words, but then absolutely make a lot of difference in
Yeah.
someone's life.
Yeah, and when I say this, don't be pushy as well. Know your
Yeah.
boundaries. Sometimes we, out of concern or out of what, but we are like, tell me, everything is going to be fine. Tell me, don't do that. You'll have to understand and create your boundary as well. I know you care about that person, but it's also important that you create a safe space, wherein maybe you ask, maybe that person doesn't reply at that time. Maybe you ask again, maybe 2 days back, or I mean, just continuously ask, but don't be so regressive when you ask that person if that person is fine, right?
I think one of the reasons why parents do not want to address it, because it's just like they feel that if they pay importance to it,
Hmm.
the problem is going to become all the more
Yeah.
prolonged. But that's
Hmm.
not the case, actually.
Hmm.
address it and talk about it. And sometimes they feel like, if I talk about it, maybe like, I'm pushing my child further into depression.
Hmm.
That's not the case, and we need to change our understanding
Hmm.
about all
Hmm.
these concepts. Talking is essential, and as you said, like, respect the boundaries, talk to them when they feel comfortable, but encourage talking. That's what.
Hmm.
And if you do that from early on in life, like, right from childhood, if the child is encouraged to talk about their feelings, I think later on also they would not find it so difficult. Because
Hmm.
what happens is that we are the kind of people, we're not used to expressing ourselves, and
Hmm.
there would be a day when, like, we really want to talk about our emotions, but because we've not done it before, it
Hmm.
feels so awkward, and you
Hmm.
feel out of the place to do that, and then you feel like you feel embarrassed to talk
Yeah.
about them.
Hmm.
Yeah.
It's just a matter of the first step. I think once you let go of that first step, it will be easier, and you'll be helping yourself and the person who is seeing you suffer but not being able to speak. And it's important that institutions, like you said, not only schools and colleges, they are an integral part, but also our religious institutions or big institutions that we have around and which are surrounded by people should speak more about mental well-being, and so that it creates awareness. Now people do understand that it's important, but awareness is lacking in the right way. um, so, and like you said, empathy is required, because even if you are spreading awareness without empathy, it makes no sense. That's what I
Yeah.
feel. Yeah.
uh,
Also talk. Yeah. Yeah.
yeah,
I,
you mentioned about the religious institutions, and this is what I would like to say, that when the concept of a counselor or a psychiatrist was not in place, maybe pertaining to that particular society, in those times there were faith healers. Okay,
hmm.
there was the concept of religion, spirituality. So all these aspects, they're very important in life, because they've held and kept together the mental health of millions of people in the day and age when, like, you did not have access to counselors. Now
Hmm.
all that I feel is that with the passage of time, maybe the situations that we face now might not be so relevant like how we had in the past. So we need to have, like, I would say, an upgradation in terms of,
Hmm.
like, how religions, spirituality, or faith healers function. But they are integral and they are important too, because they form we are closely knit in society, right, through
Hmm.
religion, through faith, through spirituality. And they can be the key drivers in creating awareness about mental illness, and also to keep somebody mentally fit.
Hmm. Hmm. Yeah, so true. Yeah. Yeah, that's one factor that people should consider. Maybe there used to be a safe space in the earlier times when we did not have counselors, wherein people can go and talk about their scene, and that person who is listening should not be able to go ahead and tell it to other people. So maybe that was a way of releasing stress. So it is
Yeah.
important that we understand and we adapt to those upgradation and speak more about it, and have counselors in place. Um, Also, doctor, do you think that the lack or the presence of dopamine void, which means excitement creation in your body, and love void, is one of the reason? Now when I say dopamine void, I say this because sometimes even our work, we have a normal 9 to 5 job, which is a means of earning, but that might not excite us. So it's very important that we have something that excites us so that we can release our stress. And the second point, love void, because sometimes we might just be so busy in our career making process or studying process, we forget about that love aspect, which is very much essential for a human being to function.
Okay, so I'll start off by like discussing about the hormone dopamine. So
Hmm.
recently you might have observed that like everybody wants excitement in life. Now the thing is that our lifestyle has been such, and like the courtesy of all the multinational companies, how they target human beings is by targeting the particular hormone called dopamine.
Hmm.
So what happens is that when you go to Instagram, there's a story that you share and there's a like. So instantly you have a dopamine rush.
Hmm.
Okay,
Hmm.
you feel good about it. Now what happens that having constantly elevated levels of dopamine is actually not a good thing.
Hmm. Hmm.
uh, it's like you have sugar, your body likes it, and you
Hmm.
crave for more sugar.
Hmm.
Okay, something like that. So there's no limit to that, and over a period of time what happens, you see, is that the same amount of response is not making us giving us the same amount of happiness. We crave
Hmm.
for more.
Hmm.
So dopamine is important. It is an important hormone, because like in illnesses like depression, what happens is our dopamine levels, they go down, and that's why we do not feel the same excitement.
Hmm.
That it is important. But I would say that like seeking dopamine on a regular basis would not be very sustainable.
Hmm.
And when you talk about the love void, what we actually are unable to understand is that what we are seeking is another hormone, which is
Hmm.
oxytocin. So oxytocin and endorphins, these are the good hormones. So what happens is that when you are in love with someone, uh, you come at a phase which is like sustained, and there's this oxytocin in your body.
Hmm.
On the other hand, dopamine is the hormone which you have initially, like you have that initial rush,
Hmm.
okay, that excitement of being in a relationship. That's dopamine. Love is more on the oxytocin side. Like oxytocin is the same hormone which facilitates the bonding between newborn and the mother. Okay,
Hmm.
so
Hmm.
oxytocin is sustained. It does not give you peaks and troughs. And this is something which even we should understand, that uh like occasionally a bit of excitement is good, right?
Hmm.
But
Hmm.
ideally we should try and keep it like happiness as a sustained emotion, or like I'm not saying that sadness is bad, but what I'm trying to say is we should try and keep it in a sustained manner rather than seeking it in spurts.
Hmm.
And again, another hormone which is the good hormone, I would say, it's endorphins. Endorphins are released when like you go and exercise, maybe go for a jog, you play something. Okay, so these hormones are the ones which I think we should take care of, and
Yeah.
that can be done quite easily.
Hmm. Hmm.
Yeah.
And also, doctor, like you rightly said, we sometimes overdo it, or overstretch it.
Yeah.
That's why it backfires also. So when we speak about dopamine, maybe there should be something that excites you, but sometimes we try to um, put so much pressure on it being creating excitement, we kind of backfire it on us. Similarly with love void, sometimes we try to put relationship the most and utmost important thing in life, which is wrong. People might think, why am I saying this? But then it should be a part of your life and not your whole life. That's why we have we have that's when we know that we have exhausted that hormone. Or especially with exercising and all, sometimes um exercise when you feel like you want to exercise. You shouldn't put yourself into a pressure that, no, I have to exercise today, otherwise this will happen, that will happen. It's when we make it work against us. So I feel like it's
Yeah.
like you rightly said, we should know how to balance those things, and make use of it in a healthy way. Some people even try to find dopamine in forms of sexual relationship, and when they do that, they harm the love void, which means they harm their relationship. So it's important that we know what excites us and use it in a way that is like a medicine, and not like over exploit it, and just be balanced throughout, right?
Yeah, I mean, like what happens is that the love void is also there, because uh, initially our views about love are usually dictated by how we see it in our surroundings. But
Hmm.
now in our generation, I think it's more or less dictated by what how we have seen it on television,
Hmm. Hmm.
on through the internet. So what happens is that we try to seek that ideal which does
Hmm.
not exist. I
Hmm.
mean, quite recently I think the portrayals are becoming more real, but that
Hmm.
was not the case when we were growing up.
Yeah.
So what happens is that you try to seek an ideal love, and see, ideal world does not exist.
Hmm.
Heartbreaks do occur.
Hmm.
Okay, you find love once, maybe twice, maybe thrice, but then it's not like love is only once. That's not the truth.
Hmm.
But over a period of time, I would say that what one has to realize is that your partner, your spouse is uh, there and is important, but more than that, there's a part of you which is unique and it is exclusive to
Yeah.
yourself, and you
Yeah.
need to keep that keep yourself alive, like,
Yeah.
and
Hmm.
uh, relationships should not be sought because you're trying to fill in something,
Hmm.
and you are not sufficient on your own.
Yeah.
Okay, I'm not saying that like that would not happen, okay, and there's
Hmm.
nothing wrong with it.
Yeah.
Like maybe
Yeah.
once that would happen, maybe twice that would happen,
Hmm.
but
Hmm.
over a period of time, if we evolve as people who are self-sufficient, and we are just seeking like a partnership for other reasons and not because like they are filling a void, I think that's something which would be helpful.
Yeah, and
The
even the term,
perception.
yeah,
Yeah.
and even the term soulmate, it means
Yeah.
soulmate, right? That means even life partner. It means a partner. It is a partner that you have shared a certain segment of your life. You cannot make it the whole purpose of your life, and you forget everything else around it. You have to now focus on yourself, what makes you happy. It's important that when you are in a relationship you communicate and all that, but it's very important to have a partner who understands that you have a personal life out of that relationship, and you should give that amount of respect and that boundary and space to the other person, and accepting that you're maybe my boyfriend. Let's make it as an example so that people understands it. Like for example, if I have a boyfriend, I cannot expect my boyfriend to forget all his priorities and give his 100% attention to me. It is equally important that me as a girlfriend understands that he has a career to take, he has a family to take care of, and I'm just a part of his life. And when we accept this, it's easier. Like you said, we have been grown up in an environment when we see a prince charming or a princess coming into our life, and that concept is just showing the part of love, and happily ever after. But that's not true. That's
Yeah.
just one part of your life. You cannot make it the whole purpose. Now when I say this, it doesn't mean that you shouldn't give importance or you shouldn't give time to the person, but there should be a balance, for it to, like I said, anything that you do in like a level that is not balanced, it backfires. And that's why many of our relationship fails, because we try to push boundaries of each other. So I think it's important that we realize this aspect as well.
So yeah, like there's like you mentioned about soulmate. So what I feel like, we should come at a point where we feel like I am a soul and I'm complete on my own, and
Hmm.
as a human being I do need like the presence
Hmm.
of another human being, but then that's not like that's not like the air without which I
Hmm.
cannot survive.
Hmm.
And then the concept of life partners, I would say that like it's not necessary, right, that the partner would be there for a lifetime. Things
Hmm.
go wrong, and then if they do, it's okay to step out of things. And again, like, see, with the change of societies, what has now happened is that we rely exclusively on one person. Now that one
Hmm.
person means the entire world. We want that one person to take care of all our needs,
Hmm.
like physical, mental, emotional, social. Earlier the framework was a bit different, that's what I would say. Like there was communities in the village, and suppose even somebody got married into a family, they were not just married to their spouse, there was his family. And like this is what I believe, it's not always that like maybe the spouse loved the husband or the wife the most, okay, they might have liked the family more than that, right?
Hmm.
There was a whole set of what I would say a framework which ensured that your mental health was in place.
Hmm.
Now you're putting all your resources, or like you're, I would say, you're investing in one person,
Hmm.
and that I feel is quite risky. So you should not be so attached just to one person who's your partner, your spouse, your husband, your wife. You need to have a set of support system on which you can rely.
Hmm.
And again, like uh, now because I'm discussing all this, people might be like, I'm not like this, so like I feel bad about it. There's
Hmm.
nothing to feel bad about it if you're
Hmm.
emotionally dependent on someone. It is a process and everybody goes through it, and then like over a period of time, maybe you can reduce your emotional
Hmm.
dependence, and it's absolutely normal if you feel that way.
Hmm. And when we say you shouldn't be dependent on your partner solely, we don't mean that you should go ahead and seek those in an extramarital affair or something like. We're not speaking about
Yeah,
that line, but what we mean is maybe your work, maybe your job, maybe your friends, maybe your
friends,
family. It's
family.
important that you have equal, like once we get married, we kind of forget the chain of life, maybe because we are trying to figure out life, and but it's important that you have a connection with them also. You cannot solely rely on one person, is because it might affect you in ways that cannot be seen right now, but later on in life it can be a risk factor of mental illness as well. So I want to stress on one data here. WHO has been stressing on ways to cope with stress, and like you rightly mentioned about one in the earlier um, conversation. Now, as for the data in Eastern Mirror is a news channel that is here in Nagaland, released information on 4th of January 2022. It reports 191 suicidal cases in Nagaland from 2017 to 2020, out of which 152 were male and 39 were female. Now, why is it that the male number is so high, doctor? Is there something that you would like to speak about on this?
Yeah, I mean, it's quite sad and unfortunate that suicides happen, and then it's sad to know that like, the rates are like this, and unfortunately males have a higher suicidal rates. Now if we break this down, there are certain factors that come into play. Now, one can be like, I do not say that the gender roles are not reversing.
Hmm.
Gender role reversal is there nowadays, but what happens is that men usually are the people who go out more often. Now,
Hmm.
I do not want to stereotype it, but
Yeah,
then
but this is
I'm just
happening.
talking it in the general
Hmm.
general
Hmm.
aspects, right?
Hmm.
So that is happening, and then what happens is that due to the hormonal compositions also, men have a greater risk taking behavior in them.
Hmm.
And earlier it was like men were the breadwinners of the family. It was again a taboo if a man is not strong. Like,
Hmm.
they say that men should be strong, women are supposed to be soft. I mean, all these concepts and expectations which the society has. And I'm positive that these gender roles and the expectations are now changing. It's not the same, but
Hmm.
I feel it would take a period of time. So men have exposure to higher risk taking activities. Okay. So the thing is that if a female, maybe she's planning on to suicide, uh, maybe she would not act upon it, she thinks about it. Men on the other hand, they think and they act faster and more easily.
Hmm.
Then second factor can be, there's so many expectations out of men. And in general what happens is that like, see, again, I do not want to stereotype, but females tend to be more expressive.
Yeah.
Okay, they have uh, a better support system in
Hmm.
place. Men on the other hand, they have good friendships, but how often do they talk about their own emotions? Okay,
Hmm.
if they start
Hmm.
talking about their emotions, it might be perceived as a symbol of weakness. And that
Hmm.
quite so often happens. Like, if a man in his friend circle, for example, shows the emotional side, the male counterparts or the male friends would be like, oh, come on. They'll be like, don't act like a girl. I
Hmm.
mean, what is act like a girl? We all are human beings, and then we have emotions and we have the need to express them. So I think these can be the factors.
Yeah.
It's
And
that I
even,
think we should
yeah,
we should
yeah,
start changing that. We should start changing our expectations that we have out of men and women.
yeah, yeah. And I also believe that it happens at home. Like for example, if a baby girl is crying, she is told, don't cry. What happened? And all that. She is given confrontation. But when a boy after a certain age cries, they are like, um, you know. Men don't cry. You have to be strong. You cannot cry. You have to take care of your family. You have to take care of sister. If you cry, then how things will work? I mean, I think that's also one factor, because we do not see men as a human being also sometimes, because we
Yeah.
feel that that person shouldn't express emotion. I mean, it is wrong. We should be we should create a space wherein a man should be able to cry, because cry is an emotion and it has to come out or the other.
Yeah, I just feel like that. Like, sometimes this is what I feel, that we are quite open about the fact that women should not be objectified.
Hmm.
Okay, I mean, that's correct, they
Hmm.
should not be, but then sometimes we forget that that, like, we objectify men by saying the
Yeah.
man has to be masculine. I
Yeah.
mean, come on.
Hmm.
If you want to be treated in a certain way, you
Hmm.
should not expect things from the other gender as well,
Hmm.
right?
Hmm.
From the other sex, right? We have to be like thoughtful about all these things.
Yeah.
And if we want a change for women in the society, like we should
Hmm.
make sure that we are not having those kind of, like, biased opinions or expectations out of men.
Yeah.
So we are human beings,
Hmm.
okay? And we have a masculine and a feminine side to us,
Hmm.
and actually there's no way to say what is masculine, what is
Hmm.
feminine,
Hmm.
right? We can say that, like, two set of qualities we
Yeah,
have,
a
that's
soft
it.
and a hard side, let's say. Hmm.
Yeah, we can say that, and that necessarily does not define a man or a woman.
Hmm.
So it should not hamper, like, your day to day life, and you should feel free to express yourself.
Yeah. Yeah, and it's important that we do also, because I'm happy that now women are coming and speaking for their rights, they're speaking for women empowerment, they're speaking for equality and all that. But even men go through a lot. They go through sexual abuse, but they are not
Yeah.
able to speak about it because of certain expectations that they have. That we
Again,
think that,
yeah, the
yeah,
taboos, yeah.
yeah, and we think that it's not an abuse if a girl is touching a man inappropriately and that guy is not comfortable. It is a form of harassment. We speak about marital rape. It happens both ways. If a guy says no, it means no. Other ways, if the guy is feeling uncomfortable, it's an harassment. And also there are so many things that the guys are not able to speak about. Domestic violence,
Yeah,
domestic
that happens.
violence. Yeah.
It's not just physical, it happens on a
Yeah,
mental
mental
plane
level.
also,
Mm.
abuse also, like, yeah, and people do undergo that
Yeah.
irrespective of being the, like, the husband or the wife or the
Mm.
male partner or the female partner.
Mm. But it's easier for a guy. It's easier for a girl to come up and say that this has happened, and people will believe. But for a guy, if some a guy comes and say, "Hey, I have been raped," what will be the first reaction? People will be like, "You should enjoy it." That's the reaction. But
Yeah,
why?
something.
Yeah, why? It shouldn't be that way. You have to be equipped. You have to respect the men emotion as well. And I think it's very important. And like we were discussing on the point earlier, this can be kind of sorted when you do not rely on a particular life partner for everything. So I think, right, I feel like it will help that way.
Yeah, I think, yeah, because if in general, like, all your expectations would change, like, uh, if the friend circle accepts you expressing your emotions, your family, your friend, your partner, I
Mm-hmm.
think then you'll be at a place where you feel that, like, it's okay to express myself, I'm not being judged, and how I feel is absolutely all right, there's nothing wrong with me, and that does not make me less masculine, because that's what, like, people think, right?
Mm-hmm.
Yeah.
And we should be able to create a space where the
Yeah.
male can come and say, "Hey, I'm not feeling well today." Give a shoulder to cry, instead of saying, "Hey, don't cry." Why don't cry? Let the person feel the emotion, let the person release the stress. I think it's also because we don't give that space of releasing stress to them. That's why they are unable to release it. At a point, it just keeps on accumulating since childhood to adulthood and all that. And it's unfortunate to see data like this.
Yeah, that's absolutely true, like, we as society have to open up again, like, there are certain biological factors, I would say, but then,
Hmm.
like, that's happening within, and then that's on account of certain hormones, but then as a society, at least we should give space for people to be more expressive.
And do not put so much pressure on the person, on the man, for being a provider, for taking care of everything financially. We know that the ladies also has an important part in a family, but it's also the male. And sometimes we just forget to respect it and be appreciative of the fact that they are going through a lot.
Yeah,
Yeah, and we see that even in our family, like our mom is more expressive and we can express things to them, but our dad are not. And I
they're
think,
closed up,
yeah,
yeah,
yeah.
because they feel like this burden of, like, responsibility, and I have to be strong. I
Hmm.
mean, like, you can be expressive and you can be strong, but see, again, like, this is dictated by how we have
Hmm.
evolved to live
Hmm.
within the societies. And I think if we're conscious about it, and because we form part of society, and we are going to be the ancestors to somebody, so we can
Yeah.
at
Yeah.
least try to create a more ambient environment.
Hmm.
If we have recognized that like flaws exist, so why not rectify them?
Yeah, yeah, and it begins with you and I. If
Yeah.
I am coming up and thinking it this way, and if I am able to, bring a little bit of thought around that process, I think it will be a beautiful space to live in, even for our generation to come. When we, speak about emotions, and emotions are not in denial, I think it's the denial stage that we associate emotions to.
Yeah.
Yeah. Um, so I think everything we have covered, and because I was also when we brought this topic out, I was also a little bit confused as to where to start, because it's such a broad spectrum in itself. But I think we have covered most of the points. But doctor, I would like you to give a message to our youths that are listening to us, not even to the youths, but every listener that is here and listening to us.
Okay. Yeah. I mean, it's a very broad topic, and I would say that we've not even touched a morsel. I
Hmm.
would say it's
Hmm.
that vast, and I'm sure like there's so much that is happening in terms of mental health. As I already mentioned, like neuroscience, neuropsychiatry, all these things, they are buzzing with activity. Okay,
Hmm.
and that's going to be the next what I would say, like breakthrough inventions, discoveries that we are going to witness in the coming times.
Hmm.
I'm positive about it. As far as the message is concerned, well, I would just say that we should create our own message, I guess. But
Hmm.
in general, I would like to say that we need to be more compassionate, and we need to develop empathy.
Hmm.
These two qualities are the basis of mental health.
Hmm.
And if and we have these two qualities, like sometimes it is difficult to understand what the other person is going through, right? But if we try to inculcate empathy and compassion, somewhere somehow we may be helping the other person a bit. And for everybody, like we undergo something or the other. And in order to make it easier for yourself and for the others, it's very important that the way you expect others to listen to you, uh, the kind of patience, empathy, acceptance, and a non-judgmental approach that you want, you should have the same for others too.
Hmm. Hmm. Hmm.
And
And
mutually we can grow.
yeah, yeah. And also, doctor, before we wrap up, when we talk about suicide, we relate it to a certain superstitious belief, also saying that maybe because the evilness took away his right frame of thinking. But it is also important to understand that if a person is thinking to end his life, that means that person is going through a pain that we cannot even imagine. That person is not able to think about the relationships that he has with his family and all that. That means it's important that when the person is going through that stage, and it's very important to start it from the very beginning, like I said, counseling in school, youth, creating a safe space, all this helps, to help us stop this from going further. Now we might not be able to stop it completely, but it will help. And there are helplines that you can always reach out to, like for example, if you are feeling suicidal, if you are feeling like harming yourself, reach out. If you do not feel like reaching out to your family, or there are helplines, reach out to them. So I think it's important that we kind of dismantle this superstitious belief that we have and take it as a serious issue.
Yeah, I mean, like when you talk about superstition, that's what used to happen in the past, right? Because even like the medical fraternity did not know certain things. They were unable to explain it because there were less evidences, right? And the general notion was that like if there's a mental illness, then like some devil has taken over,
Hmm.
like something is wrong with the brain. It is some supernatural element residing. So that would happen when perceptions regarding all these things change. And suicides have to be taken seriously because whenever there's a suicide that happens, it is a reflection of us, each and everybody of us, because
Yeah.
we live in a community.
Hmm.
And each and every suicide means that we as a community, as a society, have not done our best to ensure that another human being could get the environment to flourish. And that's really sad. And that should not happen. Suicides do happen, but how often do we like tend to question ourselves that we are a part of community, and actually each and everybody of us is responsible for somebody who's ending up their life.
Yeah.
If that kind of attitude is there, then maybe we'll become more thoughtful about ourselves, more
Hmm.
thoughtful about what we are offering to the other person.
Hmm. That's when preventive measures comes in. Like for example, that person is in a stage where he's unable to accept all the emotions that are coming in, and he's, that one particular stimulus that is coming in, or one particular variation of thought that is coming in, is taking over the others. So at that time, that person needs you the most. To help them understand that, hey, this is just one part of your life. There are things that should be more important to you. That's when the person needs help. And that's when, you can start early, create an environment which is safe. And preventive measures, I think, can help us go through, and help these cases go down. Do you think the same way as well?
Yes, absolutely. I mean, prevention in case terms of mental illness begins uh, right from the time, I would say, like when the child is not even born.
Hmm.
So as a society, the kind of environment that we are creating is going to affect like each and everybody of us. So all that I would say is that it's okay to acknowledge your emotions. Okay? It's very important that the way you feel, if you want to cry it out. If you're feeling scared, it's okay to be scared. If you're anxious, it's just okay to be anxious. And it's okay to seek help. It's not a sign of weakness. I would not say it is bravery, but it is something which is essential. Okay,
Hmm.
because weakness, strength, we are again categorizing the emotions. It is needed, and you are the most important um, thing or person that should matter to yourself. Okay, so if you're undergoing any phase in which you need some sort of help, just stop all the other activities and shift the focus immediately to yourself. Nothing else
Hmm.
matters more than that you do.
Yeah, yeah, so true. And thank you so much, doctor. This is information or a topic that I was looking forward to, because this is something that I said should be spoken more about. But I'm hopeful that our small steps will, create an initiative, which will make a difference.
I'm glad that I got this opportunity, and I admire the work that you're doing. I mean, I really appreciate that, because uh, platforms like this are essential so that people start discussing, start knowing about their feelings, okay,
Hmm.
start acknowledging things, and then together as a community, maybe we can do things
Hmm.
and actually have things in place for somebody who needs help at the right time.
Hmm.
So
Yeah.
yeah, like, thank you so much, and I really appreciate what you're doing.
Thank you so much, doctor.
Thank you.